Yes. So call center optimization is a real challenge for every organization. One of the challenges that are presented with the FQ at Cs is that we have to provide access, not just in one language, we have to provide access in multiple languages, right? So that will add a little bit of complexity, but we wanted to take that challenge on because our number one goal is to make sure patient access is delivered in the same lines as any other big organization that's out there. So we want to make access as easy as possible, remove the complexity of it because language, it creates a complexity, but at the same time, when you figure out ways to kind of remove the complexity out of it, it makes things so much easier for our patients and for our providers. So that is something we tackled. So we used an AI solution called Attuned AI that we've implemented initially. We piloted it with our call center for after hours support so that, we were trying to balance it with the business hours as well as the after hours, and also want to make sure that how is this being received by our providers who are on call versus how is this being received by our patients. So we piloted it with our after hours answering service. We had AI start taking all of those calls. And then it was very interesting the kind of information we were able to discover with the data that was now starting to be coming to us, which we'd never had before. So once we started rolling it out to the after hour services and started to see what type of phone calls do we get during after hours from our patients. Majority of the time, it's a patient who's trying to ask for information, which typically needs to be called during business hours because we're not a 24/7 like a hospital. We have certain business hours. So the AI was easily able to at least provide that guidance to the patient, say, please call back during business hours. And that just reassurance and say somebody's actually giving me some instruction on what to do versus just directly passing it on to the answering service who may have their experience in answering these type of questions, but why send the patient all the way through all those hoops? And then again, why, if we can answer those questions, then having to page the provider and having them call only to find out that this has to be addressed during the business hours. So through that, we identified a lot of these workflows that we've had for ages and ages where we realized, okay, there's a simpler way to do this. And this is going to not just help our patients, it's also going to help our providers. Once we looked at that whole process, we said, okay, let's scale it to business hours. And we started doing it incrementally for a couple of hours initially, and then extending it to 2, 3, 4 hours. And then like your experience working with other organizations, the results were pretty evident. We saw about a really high engagement rate with our patients trying to see, well, now I don't really have to be on hold for 1 hour, which is reality when you look at the volume that comes in through a typical call center. So now the AI is now able to handle all our business hours, initial interaction with our patients, and then the AI is able to answer some of those questions, basic questions that it can be answered. And again, we were taking a very conservative approach to this. While it has lots of capabilities, we were like a crawl, walk, run, just so we want to make sure that the experience for our staff and then the patients was good. And the results were around the abandonment rate. We start to monitor our abandonment rate, which historically was really kind of high for us given the volume. And typical FQHCs, we can't always have 50, 60, 70 call center agents. We're small organizations and we're spread thin, so we have to maximize our staffing. Call abandonment rate, and then how we were able to triage. Again, during the business hours, the key is, even before I emphasize on the outcome and the results of it, I want to emphasize more on what was the information we didn't previously have that we now have because of the data that the AI is providing to us. What are the top 5 reasons our patients are calling us for? And medication refills, lab results, scheduling, and some of these are like, I need to speak to my doctor about an upcoming appointment. We looked at that information. That data was pretty compelling to look at, say, wow, we now have a way to streamline this information and make sure that this patients can actually talk to somebody who can answer that question and then resolve it on the spot. And now you got to take the next step to say, now, how can we automate this? We started to think about, okay, now we have to think about how do we integrate this within our electronic medical record workflows so that our staff don't have to just constantly create these communications to say patient call for XYZ, patient call for XYZ. Rather, the AI is taking that information and creating the communication where it needs to go to, and our call center staff are addressing the most complex needs of our patients who are calling and want to reach a live agent over the phone.